The first thing I'd suggest is that it's important that you stay hydrated. So this might be drinking water or maybe some sugar-free juice. If you have a fever or aches and pains, I'd recommend using acetaminophen or Tylenol to control those symptoms and fever rather than using ibuprofen or Advil. This is probably a safer choice. If you have type 2 diabetes and you take insulin or you take tablets like glyburide or diamicron, it's probably worth watching out for low blood sugars, particularly if you feel that you're off your food or you've lost your appetite. I'd also suggest that you get in touch with your doctor or your healthcare team to check whether or not you should still take your metformin and or your blood pressure tablets, as when people get sick and dehydrated, sometimes it's safer to temporarily hold these medications. If you have type 1 diabetes, it's probably important to remember that you must not stop taking your insulin, even if you're not eating very much. You may be surprised that you need extra insulin or more than normal when you're not well with a fever or inflammation from diseases like COVID. And I would recommend that you keep checking your blood sugars on a regular basis. If the blood sugars are very high or you have nausea or vomiting, it may be worth checking either blood or urine for ketones. If you have ketones in your blood or in your urine, this is a sign that your body needs more insulin, and you should take some extra insulin even if your blood sugars aren't particularly high. If you're worried about low blood sugars, you can always take some juice or a small amount of carbohydrate to balance out the insulin. I hope that you don't get sick, and if you do get sick, that you get over it very quickly. But it is worth remembering that, we have hospitals for a reason. They're there to help us. So if you can't get your blood sugars under control, if they're running consistently above 20 despite your best efforts, if you can't keep food and fluid down, you're throwing up, or if you have trouble breathing, just go to hospital. Whether you can get there with family members or whether you need to call 911, don't wait at home. Sometimes it's better to go in at an earlier stage, have a shorter stay and get home faster than waiting too long and it being a bigger challenge to deal with. So I hope you're managing to stay well. I hope you're managing to cope with your anxiety. I hope we've had a chance to get out and enjoy some fresh air, and I hope that this advice is helpful.
I absolutely love questions that are related to preparation because it really makes for everybody's time to be far more efficient and makes for appointments to be that much more satisfying for both the individual as well as for the healthcare provider. So in this day and age of virtual type appointments or phone visits, what are some of the things that you can do to prepare? I think number one is making sure that you have the date and time correct for whenever that appointment is scheduled. In the case of a virtual visit, which is online, you will likely be sent a link via email, so making sure that you have your computer set up and your internet connection is critical. If it's a phone visit, then you'll be given a window of time in which you will be receiving that phone call. So again, making sure that your phone lines are open and available to receive the call. For the appointment itself, I think it's very important to have your medications readily accessible. Ideally, a bag of medications or a little container where you actually have the bottles or boxes themselves, because we will often be asking for you to try to spell the names out, given that those names are hard to pronounce, or ahead of time, you may be asked to take pictures of your medications to be emailed to the office ahead of time. For those of you who need reading glasses, make sure your reading glasses are nearby to make that move easier. And for those of you who are measuring your glucose levels, please have your glucose levels readily accessible. In the current day and age of having so much technology, for many of the devices that you use, you can ahead of time connect with your clinic and actually share the information remotely, which is very useful as well. And things such as LibreView or Clarity or Diasend or CareLink are options where you can actually share your data ahead of time. And then, of course, be prepared by having your questions written down. And this would be true of any visit, but particularly for a virtual or a phone visit, where it's a different environment, so it may not come as natural. So being prepared actually makes a big difference. And please do not be afraid to ask any of the questions that you normally would have asked, because these appointments are meant to be for you and meant to be as useful as possible. So be prepared, which will then make for a very satisfying appointment for both yourself as well as for your healthcare team.
Language matters. Having diabetes is tough, and many people don't really understand what diabetes is, let alone what it feels like to live with it. The words that people use can build us up, but they can break us down as well. Most often this is due to carelessness rather than any intention to harm, but either way it still hurts. Around the world, people living with diabetes and healthcare providers have been working on this idea that language matters. We want to let people know that the words they use counts. This is important when people talk to people living with diabetes, but it's also important when we talk about people living with diabetes. This project of raising the issue that language matters is going to be relevant across Canada. It's going to be relevant to doctors and nurses in hospitals, in clinics. It's going to be relevant to the media, to government and to policymakers, but also to people that you meet in the street and your friends and neighbours. But this is just the start of the conversation. Changing the words that people use is a first step, but the more important task is helping people change their attitudes towards diabetes and to the people who have to live with diabetes. I hope you'll join me in supporting this initiative, which we hope will make a difference for people living with diabetes across Canada now and in the future.
Kids and parents who are dealing with diabetes during the COVID-19 pandemic can find valuable resources at the new website covid19childhooddiabetes.com.
The website has information about the management of type 1 and type 2 diabetes during the COVID-19 pandemic. There's also a section that deals with parenting during this time. In this section, there are also information that parents and caregivers can use to spot stress in children and to provide support to them and talk to them about COVID-19. There's also a section that deals with the prevention of the spread of the virus. It contains information about physical distancing, covering coughs and sneezes, and the use of masks. And there is a section on the website that addresses the maintenance of a healthy lifestyle and emotional and mental well-being during this time. In this section, there's also lots of information related to fun and educational activities that family members can engage in while we're staying indoors during this time. There's also a section that includes frequently asked questions and mythbusters about what COVID-19 is and isn't. We encourage you to read this section as it has a lot of important information that families, children and youth have found very useful